Thank you, Angela. Hard to believe, but we're into the final segment of this morning's event. So that final segment is a panel discussion, which I'm pleased to be able to moderate with our co-chair today, Sadhbh, who you met this morning and who is our Youth Research Council Chair. So I'm pleased to be able to introduce our panel. So in addition to Professor Debra Rickwood, again, who you also met this morning, we are joined by Dean Murray, who is a youth advocate for the fundraising team in Jigsaw, a member of Orygen's Global Youth Advisory Committee. Dean's a graduate from the Community and Youth Work programme in Maynooth and has volunteered with Jigsaw since 2018. Unfortunately, Dr. Gillian O'Brien has had to step away for urgent reasons, but we're delighted to have Paul Longmore join us. Paul comes with significant clinical experience. He's a regional clinical manager in Jigsaw who's led the development of Jigsaw Online. Paul is also chair of the Psychologist Registration Board. And then finally delighted to be joined by Professor Barbara Dooley, who is Dean of Graduate Studies and Deputy Registrar at UCD. She's a Professor of Psychology at UCD and in her spare time, an active researcher and supervisor. So obviously, Barbara will be known to many of you as she was Director of Research for Headstrong, now Jigsaw obviously, previously, and is the Principal Investigator for My World Surveys 1 and 2. And Barbara's joining us from Italy, so we're expecting your contributions in Italian, Barbara.
No pressure, Aileen.
So, no, none. So, Sadhbh, we obviously have a couple of questions that we'll put to the panel, but we would again invite you, if you would like, to submit a question via the Q&A feature on the main event page. And again, I will do my best to put some of those to the panel. So, Sadhbh, I'll hand over to you. Have we lost sound on Sadhbh?
Sorry, of course I was on mute. So my first question is for the entire panel. So what do you see as the biggest contribution research has made to this area of youth mental health? So that is delivering mental health services and supports to young people.
I can start if you like. I don't mind.
That's great, Barbara.
Well, when I was looking over the questions thinking about what I might say in terms of the contribution of research, I think firstly I wasn't able to hear all of the contribution from the previous session on young people, but I did get all the nuggets. I could hear young people being at the core, the importance of the voice of young people. But in terms of the overall research, I think for us in Ireland, I think My World Survey 1, which was really the starting point of the research journey in youth mental health and creating an understanding that looking at the mental health of young people was core to what we do, providing a platform for then Headstrong and now Jigsaw to actually advocate on behalf of young people for the investment of appropriate services at a time when services were not, shall we say, young people themselves weren't considered to be at a different time in life and where it would be important to see what would be working best for them. So I think that would be where I'd start. There's other things we can talk about later. So that was for me one of the things was My World Survey 1, I think really was the starting point in Ireland, providing an evidence base for research and the reason we do it and the importance of it for looking at services after that.
That's fantastic. Thank you, Barbara. Does anyone else have something they'd like to add?
Yeah, I'd add, I think that's really important, our understanding of the level of need for these types of services for young people, and also the factors that affect their reticence to use services. So I think research, we have a really strong base on what the barriers are to young people accessing and engaging with services. So I think the research field has really informed service development from that perspective.
There's actually been a question in that maybe picks up on the points that both of you have made, Barbara and Debra, around how research has empowered engagement with government in terms of attracting funding or improving mental health literacy in Parliament, collaborations, etc. So maybe just picking up on that, would you agree, I guess, that research has been useful in that respect? Any key learning or challenges even in managing those?
I would agree. I think when I again thinking about research, one of the other things I thought about was the importance of research in terms of getting funders, such as government, to understand what Debra has talked about was the need. So if you provide the evidence, government are much more likely to listen to evidence rather than, even though stories can be extremely powerful, and I think they really support, shall we say, data. Hard data are often are not really the story, because everybody's story is individual and different, and we need to hear the story. But to actually make a case to government, you need more than the story. And I'm not minimizing story here at all. So don't. And that it's just that an individual experience is one person, but when you can actually provide evidence on 15, 20, 30, and when you look at some of the work in Headspace, thousands of young people, that's a powerful case that funders and government have to listen to.
Yeah, it's the combination, really, isn't it, of both?
Absolutely. Yeah, it's neat.
The other thing
It's like anyone. Sorry, Deb.
That's all right. Go ahead, Barbara. There's a bit of a lag for me too. But I was just going to say, add that one thing that's, I think, really validating internationally, it's fascinating to see that independently it comes up with the same things as well. I was just listening to the presentations beforehand, and I was stunned by how similar the data are, and the patterns are, and the patterns of use, and what people are doing in Ireland and in Australia, and as we know, in Canada. And that's really validating to sort of get that our research is bringing through that information, and that then becomes really compelling to governments when there's international stuff as well, to say, it's not just us banging this drum, it's happening worldwide.
I would maybe just go back to the original question, Aileen, and just say, with the specific example of Jigsaw Online, I think that research and evidence really helped us understand and clarified what works for young people and how young people want to receive a service. So we were able to really kind of distill down the evidence and the research into kind of key service delivery principles, that to understand that young people want to have more control, more choice, more autonomy in terms of how they engage with services. And that really helps us then to design services that are going to meet young people's needs. And in that way, I suppose, just going back to Debra's kind of overarching maybe theme of change and evolution, I think that research can really guide that change and evolution and help us change in ways that are going to meet needs to a greater extent, or meet the needs of different groups of young people.
Definitely. The challenge is doing it in a timely enough way, isn't it? Because I laughed out loud earlier, Debra, when you showed those pictures and talked about change, because it absolutely rang home just how fast things move, and the pace at which change happens. Yeah. Maybe then just picking up on service delivery, Paul, and for Debra, and also for anybody else who'd like to come in, as people working directly with or in organisations providing mental health supports to young people, what do you see as the biggest challenges in ensuring that evidence is effectively gathered and used? And, any advice around maybe ways to manage or overcome those challenges?
I'll start if that's okay. Yeah. I think we've found very much, and my sense is the biggest challenge for us is often the clinical need that's in front of people, and the demand and the need, and having young people and families there in front of you with high demand, with really high needs, that become, that is the immediate focus, that quite rightly is the focus of the service providers. So that makes collecting data very challenging, and it makes disseminating information challenging too. Not as the service providers and clinicians are, antipathetic, and they're especially not in youth mental health, because I think it attracts people who can cope with change and want to learn to do things differently. It's not the people who are stuck in their ways at all, but they don't want research to get in the way of their practice. So it's really important that, when you're trying to collect data, that it doesn't interfere, that it adds to their practice, and they really need to be able to see how it's meaningful now for this young person and their family that they're working with. And that's really hard for research, because sometimes our research can get it appears a bit obscure. It takes a long time, and by the time we've got back to people about it, that's not how people work clinically, and particularly in our field. So those are challenges, and I guess the way around it is constantly working to make what we do meaningful, and that it's a priority for young people and also for the people providing services to them, and to do it in a timely way. Like when a need arises and people, they want to know the answer then, not in 5 years' time when we've got our grant and we've got our ethics approval and we've collected our longitudinal data. So, it's hard.
Yeah, lots of nodding heads.
There's maybe some overlap in terms of my answer, Aileen. I think that for me, at a fundamental level, it's about looking at what constitutes evidence, and really trying to maintain the multiple strands of evidence that that incorporates kind of traditional research and evaluation evidence, but also brings in service user perspectives, values, and also clinical, more practice-based wisdom. So, those kind of three strands that constitute evidence-based practice, and really maintaining those three together, valuing them, incorporating them, and maybe trying to find a common language that's meaningful for everyone. Because I think sometimes it does feel like if we take, maybe clinicians, researchers, and service users as a very crude division of the key stakeholders, sometimes it feels as if we don't necessarily communicate very well with each other, despite us all looking at the same thing of youth mental health and youth mental health services. So I think evolving some sort of common language that's meaningful for everyone. But I don't think that that's just incumbent on researchers and academics. I think that's maybe incumbent on all of us to try to come closer together and maintain that dialogue that has those three different components.
Yeah.
Yeah. And I would add something as well about the researchers themselves, that they, just picking up on Paul's point, it's not just even about the language, but that researchers need to be, I think, very ethical and have integrity when they do the research, that they're not just parachuting in, gathering data, publishing, that actually it is a meaningful engagement, and particularly in the area of youth mental health, and particularly with young people and services, that there is a trust relationship in terms of the research that's done, so that you have integrity with what you do, and that also that the research should be more than just a peer-reviewed output, which in itself may be important for the researcher, but may not necessarily be for the service user or the service in question, but need to be able to demonstrate impact. And that may be going back to story and seeing through story the impact that the research has done. And I think some of the videos I could see there, Aileen, even though I couldn't hear everything, I could see that there was a narrative and a story around that that's very powerful, and it kind of demonstrates the value of research. So I think it's all of those things, Paul. Yeah, and I think I hear the challenges that Deb was talking about. I'm also doing some work on a national database for student mental health counselling services in Ireland. And again, it's that the buy-in from the counsellors is there, but it's to try and ensure that what we do has meaning, and it isn't a case of just collecting data for data's sake. So it's and challenges of in a very busy, high demand services. As you know, the higher education institutions will have huge demand on their services, and trying to ensure that what you do doesn't get in the way of the work that the service itself needs to provide.
Yeah, absolutely. I think for sure, in terms of measurement selection, clinically meaningful measures for both the young people and clinicians is key, isn't it, in terms of getting buy-in? And Sadhbh, I'll hand over to you.
Great, guys. So my next question is for both Barbara and Dean, which is great. We'll get a variety of perspectives here, which is nice. But the main question posed today about delivering services to young people is, what have we learned and where are we going? So I suppose my question to the two of you is where do you think research or evaluation can make a stronger contribution in this area? And do you think there are particular groups that need attention? So Barbara, if you don't mind, we'll start with you.
He hasn't had a voice there yet, so I was really hoping you'll start with Dean. But anyway, I might just, I'm going to focus maybe on one. Sorry. Could you go ahead?
I think we've lost Barbara there for a minute, have we? Yeah.
Can you hear me now?
I think we may have. Yeah, we can now, Barbara. Yeah.
I could see left out. I was saying, could Dean start, and I'll come back.
Okay, Dean, would you be ready to offer your answer?
Yeah, so I think like one of the big groups that we sort of need to hear from for youth mental health is sort of members of the Irish traveller community, because of how bad they can suffer with mental health, and the research already shows that the mental health across all ages is so much higher than sort of the settled population. So it's really important that we hear from those young people, and it's sort of their voice that will help change the direction again of what services are provided and how it's done, because they mightn't have the confidence or the knowledge of how to access services already. So it's changing how service delivery is done to meet their needs.
Mm-hmm. Yeah, I think that's a fantastic point. Fantastic point, Dean. Barbara, have you anything to add to that?
Well, I certainly would support what Dean said there. I know that Jigsaw a lot with young people, and so I'm very familiar with all of the work of Jigsaw. But one of the things that I've been kind of looking at more recently is also student mental health, the mental health of students in higher education. So my work survey too provided us with some fantastic data on different cohorts of students. So I think there's this idea students are students and they're all the same, but they're not. Just like anybody else, there are lots of different groups of students in our colleges and our universities, some of them coming from very diverse backgrounds, some of them from more traditional backgrounds, some of them with different ages. These in themselves have uniqueness about them that are often things that aren't maybe in sharp focus. So I think there is a lot of work to be done, I think, in identifying different groups of students and potentially identifying what their needs are and supporting them away best based on their needs. So it's a bit back to some extent what Dean said, that Irish travellers have particular needs and are a group that are often and not heard as much. I also think within universities and colleges, everybody says, oh, they're colleges, their students are great, you know, aren't they advantaged, having a great time? But there are many groups within that coming from very diverse backgrounds who have much higher levels of mental health than, say, students that might be traditionally coming in from schools and other areas. So we need to be mindful of the uniqueness of not just the individual, but also the uniqueness of different cohorts of students. So that's kind of one thing maybe to add.
That's great. I'll pass you back to Aileen.
Yeah, I think just to agree with both the Barbara and Dean in terms of the points that they've made, and I think maybe there's a recognition now that it isn't also in youth mental health research. It's not just about one identity factor. It can be, you know, a number of identity factors in combination with each other, but also the intersection between those different factors too. That's important.
Yep.
For Dean and Sadhbh, I guess we did hear from the YRC earlier, and I think most people here know that many mental health services, they were set up with youth participation structures in place. And there's definitely been a move in research in recent years to facilitate what's often called PPI, public patient involvement or youth involvement in research. But that's a relatively new practice for lots of people. And from your perspective, do you think that there are ways that we could strengthen the role that young people play in research in this area?
If I could jump in, I think the biggest thing in strengthening the role of young people in youth mental health research is offering meaningful research involvement as opposed to just research involvement in general. So what I mean by that is that something I've experienced in Jigsaw is that the research I've done, I feel that I can see the impact I'm having on the research processes that I've got involved in. I've seen them come into fruition. I've seen the end result, I suppose. So it hasn't felt like a tick box to say that they're, engaging the youth voice. And I think the ways in which Jigsaw has been effective in doing that has been the kind of demystifying the process of research. So there's been training offered to young people in kind of research processes and methods to kind of make it quite clear what each stage of research, what's happening in each stage, what's involved in each stage, so that young people can offer meaningful contributions. And also there is training on the other side. So the R&E department, all of the staff have been trained in how to effectively and meaningfully integrate young people into their processes as well. So I think having training on both of those sides has been really helpful and will be helpful going forward as well.
Yeah. Thanks, Sadhbh.
I suppose agreeing with Sadhbh on the importance of training, and for some young people that can be the carrot at the end of the stick, is learning how to actually carry out the research and the evaluation. So having the free training available for them can sort of be the buy-in, but it's also about at the very beginning of a research process that young people are co-designing how it looks, from the questions to sort of the method of how we're getting the questions answered for young people. So it's from start to finish, young people are fully involved and are fully trained with the knowledge on what they're doing. And it's not just sitting in the meeting as a silent partner and hearing what's happening. They're fully able to sort of contribute and give their thoughts on it.
Yeah. And I think actually to just add to what Dina said there, when you have young people integrated from the beginning of the research process, it really fosters a sense of investment and ownership as well in the young people, which I think kind of creates a feedback loop where people see, they get invested from the beginning, they follow the project to the end, and then they feel how rewarding it is to be involved in something that's going to have an impact on the mental health of them and their peers. And I think that encourages people to invest their efforts in more research and get involved again in other activities with mental health organizations. So, yeah.
I think some wise words for maybe some funders are those that, give grants to researchers and encourage PPI. I'm not sure really if they consider the breadth of what's involved and some of those things that you've talked about for sure there. I don't know if anybody else wants to come in on that.
I'd like to maybe add that, I hear that the learning that young people might be getting from being involved in terms of training and opportunity, but we must all, what I find is when the other happens as well. So when we were doing My World Survey 2, we were 3 times we went back to to young people to listen to what should be in the survey. The problem was they wanted more than we could deliver, because there was every said, oh, keep everything in there, ask more. I said, well, maybe not, because we need to actually make sure we get data. But we learned so much. I mean, I think researchers learn as well. I mean, so we have to listen and learn, and maybe we need some training in listening too. So it's not a case of just young people are doing the learning. I think the researchers are equally doing the learning and should be open to the learning as well. Certainly, I found the engagement when we were doing My World Survey 2 was really powerful. There was a room full of people talking, discussing, giving feedback, having their voice, and they certainly were the key to the shape of what My World Survey 2 was about. So, and again, it's a lot of powerful data building on My World Survey 1. So it's not all about people giving, it's and learning, it's reciprocal. I think for the get engaged together.
Thanks, Barbara. Conscious of time, and maybe Sadhbh, you've got a final question for people before we wrap up.
Yeah, so this question again is to all. So if you have something to say, just jump in, I think. So to finish up, what would you say is your key takeaway message from today? On the spot there a little bit.
Well, I didn't get to all this earlier sessions, but I think from what we're hearing just this session, one, I think that research and evidence is key, whether you call it data or looking at evidences into services. So evidence is key. It's powerful. It's impactful, not just for the young person who may be in receipt of a service, but it's powerful for making a case to government and funders. And we know there's still a huge amount of work to be done to have adequate sources for all young people in Ireland and more globally. So I think it's the voice of young people, it's data, it's impact, it's story, it's a combination of things that actually create the power of research. And seeing research as more than just bits of numbers with story.
Yeah. And I think I'll add to that, and I think Paul was saying this. It's when you bring together the research skills and the research perspective, but that's nothing. You need the young people's perspective, you need the family's perspective, you need the service provider's perspective. It's when all of that comes together going in the same direction that you get something powerful and something meaningful, and that you can implement, and that will make change and make our service systems better, which is what, we're in a very applied environment. That's what we want to do. There's a real reason right now to do this research. So it needs to be meaningful and impactful.
Yeah, I think sometimes maybe clinicians and clinical staff at times can feel like research is a little bit removed from the day-to-day of what they do, from what happens in the relationship between them and a young person and their family. And I think that we've got to try and bridge that gap a little bit. And I think that, talking about impact, talking about story and narrative, as well as, data, I think is really helpful for that. And I think it's important that clinicians remain open to this. This is fundamentally about thinking about what works, what in what we do is helpful for young people. How can we improve young people's experience? And that's something that we are all very invested in.
Yeah. I think I was at the launch of the HSC National Framework for Research recently, and there was a line at that time that stuck in my mind, which was that research strong settings are generally clinically strong settings. So I do think it's very much about partnership, isn't it? So that's it. I think we'll have to draw to a close. I'm sure people are ready to lie down or get lunch or stretch. So thank you everybody again for your time this morning, and I am going to hand back to Dr. Joseph Duffy, CEO of Jigsaw, for closing remarks.
Hi everybody. I just want to say thank you so much for the time and effort you put into participating this morning. We set out early to talk about compelling evidence, to challenge assumptions, to air the voices of young people, to progress the conversations around mental health service delivery and translate the evidence of policy into practice. I think, and I know I'm probably biased in this, is that we have actually achieved those objectives. I've been hugely impressed by the range, the breadth, the depth of the conversation this morning. But a couple of key things that struck me, really listening the important point that the universal is very much local, the compelling international view and the comparisons between Ireland, between Australia, between Canada and other countries of what young people are saying. I think that's really, really strong and really strengthens us in terms of the work that we're doing together. it's really important in terms of keeping relevant and keeping real. And I think having the youth voice this morning and having that very strong, listening to what young people are saying, the translation of that, of the evidence that we have into practice, but also practice into evidence, and looking at the clinical wisdom that's there, and how do we systematize that, and how do we structure that, and how do we really help to make sure that that's integrated and policymakers and others are listening to us. I just want to thank the Professor Debra Rickwood for taking the time to see what is her evening for her in Australia to spend with us. Has been incredibly valuable and really, really supports the collaboration that we have between ourselves and Headspace. I'd like to thank the panel who you've just been listening to there, the Research Council. I'd like to thank Aileen O'Reilly and her team and all the other staff within Jigsaw, the digital and the comms teams, youth mental health promotion. Everybody's put such a huge effort into making this whole event possible. What I want to leave you with really is the quote from one member of the Youth Research Council, who said, I used to see research as for somebody who had studied it. They're the only people who could understand it. Now I realize that that's not true. I think if we can make sure in the work that we're doing that we're involving young people who are the future and who are going to be helping us in terms of developing service into the future and supports for them, to keep them close in terms of close to mind in terms of what we were doing, we will be doing well. Thank you so much for everything, and thanks for your time and interest this morning. Take care. Bye bye.